Hi, I'm Dr. Edward Gross with Primera Plastic Surgery. A common question I hear from patients is, how are moles removed? Moles on the face are typically removed for cosmetic reasons, and very rarely are they anything other than benign conditions. If, however, they are suspicious, we can send out for a biopsy and get a pathology report. Getting back to the removal of moles, typically these are done under local anesthesia in our outpatient surgery center here in Lake Mary, requiring less than 20 minutes, done under a local anesthetic. The most important thing in deciding whether to remove the mole using a shaving technique, a laser, or a Minifusiform excision is where it's positioned. The shaving technique is the most common way we're performing mole removal. During this simple procedure, we take a very precise, sharp scalpel after the skin is numb and plane down the skin, removing the skin tag till it's a smooth surface. Alternatively, we may end up using a laser to get a little bit deeper into the subsurface of the mole to prevent its recurrence. The benefit to using a laser for mole removal is that there's almost no residual scar with that, and a lot of patients like that option, although it's a little more costly. The healing time is very similar between laser treatment and the shave excision because they're both covered with a small band-aid anywhere from 3 to 7 days, with just a little bit of ointment placed on that to get the skin to heal. And then of course, avoiding some sun following that is very important. The final way that we'll remove moles from the skin of the face is what is called a Minifusiform excision. This is a tiny little football-shaped excision of skin around the mole, taking a small border and then excising it in what we call full thickness, again under local anesthesia, so there's no discomfort. And then doing some very delicate and precise suturing of the skin to close up the tiny area that we excise. The procedure requires a little more healing time and may result afterward in a faint pink scar that we go back and lightly treat with a laser as needed. And the placement of those Minifusiform excisions is critical so that they're in what's called a relaxed skin tension line, or what patients might call a natural crease. We hide the incisions in very nicely placed spots so the skin tension line and adjacent areas can help in hiding it. I hope that helps in understanding how we approach mole removal at Primera Plastic Surgery.